You should definitely be able to identify the nerves that we talked about. I would not ask you to identify parts of the spinal cord on this, okay? This thing here is the cervical plexus, okay? So the whole thing, where it looks like all the nerves are kind of tangled up with each other, that's the plexus. This nerve right here, that one is the phrenic. It looks like it's kind of headed down this way because it's coming down to the diaphragm. Okay, so, and it's the one that's marked right there. Okay, this is the brachial plexus, and so the nerves that we talked about would be this one, actually I'm sorry, not that one, this one is the axillary, it goes to the shoulder, okay. This one that's coming down this way is the musculocutaneous. It comes down to the anterior arm, okay, musculocutaneous. This one that is right in the middle is the median. Okay, median. The ulnar is the one that I said travels right between these bones here. So remember, it is medial. Okay, the ulnar nerve, it's going to supply the pinky, like when you hit your, you know, the funny bone, that's the ulnar nerve. And you get that tingling down into the pinky. Okay, this one is the radial. It's the only one that's left. Okay, so again, the axillary, musculocutaneous, this is the median, this is the ulnar, and this is the radial. Okay, these are intercostal nerves. I don't think I have this on your list, but we talked about those. Maybe I'd make it extra credit. Okay, intercostal. Okay, this is the lumbar plexus, and coming out of that plexus would be this kind of smaller nerve that goes a little bit medially here. This is the obturator, and the big one here is the femoral. It comes down to the anterior thigh. Okay, so obturator and femoral. The really big nerve, the largest nerve in the body is a sciatic, and so that's the really big one here. Okay, so this is all sciatic, and here's where it splits. This one that's going to go out laterally is the common fibular or common peroneal. You can also see it right here. It travels right by the head of the fibula, so that's it. And then it splits. These branches are not on your list, so don't worry about those. Okay, so that's common fibular, and this other one that comes all the way down is the tibial. Okay, and that is it.